our conversation this morning. Actually, we were already chatting about it, but we'll include you now. Of course, we are talking about the new diabetes program that was launched by the Ministry of Health and its partners, and we have with us to discuss it further Kathleen, who is the technical advisor for HECOPAB, and we also have Anthony Castillo, who's the president of the Belize Diabetes Association. Good morning and welcome.
Morning, Marlene.
Good morning.
Morning,
Thanks
Sunny.
for having us here.
So Kathleen, let's just talk about what HECOPAB does. It's the health and education portion of the Ministry of Health.
HECOPAB is the Health Education and Community Participation Bureau. It's the health promotion arm of the Ministry of Health, and we work closely with the community, particularly in educating and promoting healthy lifestyle practices. And we have our district health educators who are part of that HECOPAB team, as well as our network of community health workers nationwide.
Yeah. So let's focus in on the issue here. And, you know, for a first conversation on a Monday morning, I think it shows the importance of this topic. Diabetes in Belize. Mr. Castillo, we've been talking about it every single year, several times a year. It is a concern for us. How much of a concern should it be?
It is still a concern, Marlene. Diabetes, at this time, we're looking at a little over 50,000 Belizeans who may be living with the condition. Quite a significant number of Belizeans are living with this condition. Hence the reason for this project. This project called the Belize National Diabetes Self-Care Program is so important. A person diagnosed with diabetes, you go to the doctor, you're diagnosed with the condition. You spend 15 minutes, maybe 20 minutes, maybe half an hour with the doctor. Thereafter, you're on your own, right? So it's very important that you learn how to cope with this condition, and also it will avoid the complications of diabetes. So the more the person knows of his condition, the better he'll be able to cope and live a fairly decent life with diabetes, as we say. This program is funded by the World Diabetes Foundation. A grant was given to us, and we're partnering with the Ministry of Health to implement this program. And we are so happy that the Ministry of Health are joining with us. We're working together. We have always have a good relationship with the Ministry of Health, and it continues through this program.
Go ahead.
This program will be training, as we should have said earlier, we train the health educators. Thereafter, we will train the community health workers and eventually the persons living with the condition.
Now, I gather that this will be a robust campaign in terms of trying to educate as many people about diabetes on a whole, living with it and how to manage and mitigate, etc. Is it that we still consider diabetes to be perhaps one of the #1 killers, if I may, in terms of any kind of affliction that may bother us or plague us as Belizeans?
Well, in Belize, the prevalence of diabetes is around 9.9%, with females having a higher prevalence than males. And the thing with diabetes is that the symptoms usually would display themselves over a period of years. And so it's important for individuals to know the risk factors, such as being overweight and obesity. So if we could, put attention on prevention and early diagnosis, then we can, mitigate and decrease the burden that the disease has on the Belizean population.
Yeah.
Right.
Now, with 9.9, almost 10% of the country probably being diagnosed with this condition, and the way we talk about diabetes, it seems so commonplace. Why is this still a priority for the Ministry of Health? Is there something else that we're missing in the conversation?
Well, at the community level, we feel like that it's very important for us to educate individuals. Yes, we have patient education and self-management at the clinical level, but it's also important for us to do it at the community level with the assistance of our CHWs. And the reason given that these community health workers or these volunteers are individuals who are very familiar with the challenges and limitations that their communities face. So we find that given their knowledge and understanding, they can relay that education in a very effective manner to the lay community members. So we find that that's very important. And also, not everyone, for whatever reason, you know, given cultural barriers, language barriers, financial barriers, not everyone might access healthcare or receive it that easily. So we need to put that emphasis at the community level.
From what we've discussed in the past, diabetes or being diagnosed with diabetes is only one part of it. Where we're seeing the challenges when people don't maintain their sugar levels and then they develop the complications. Once upon a time, and I don't know if it's the case today, it was one of the leading causes of death, diabetes-related complications. Is that still the case in the country?
It definitely is. We have, apart from the symptoms, frequent urination, increased appetite, weight changes. We also find severe complications around diabetic retinopathy. We have increased blood pressure. We have kidney failure, and also impaired blood circulation, which can then lead to amputation. So those are some severe complications that we are seeing at the hospital. And before we reach to that point, we want to prevent and have early diagnosis before going to that point.
Is it fair a description to say that diabetes is a lifestyle illness?
It definitely is. Apart from genetic factors, we also have behavior risk factors around nutrition, your weight, physical activity. We try to promote and encourage individuals to eat healthy, encourage healthy consumption of foods, fruits, especially among younger children. This starts from birth and early childhood. Encouraging healthy snacks and discouraging the consumption of sugary drinks, and also breastfeeding, programs that promote breastfeeding. So those are different things that will eventually try to minimize the burden and the risk of diabetes, for sure.
We at the Belize Diabetes Association, we are a support group for persons living with diabetes. So once those persons are diagnosed with the condition, we try to invite them to our meetings and inform and continue to educate them. As I said, once you develop a condition, it's for the remainder of your life, and it affects everything, all the organs in the body, right? It affects from the hair on your head right down to your toes. So the more informed you are, the better you'll be able to cope with diabetes.
Another risk factor, which I haven't heard us discuss as yet, is alcohol consumption. What's the link between excessive alcohol consumption and diabetes? Because we've seen people who are not obese and people who may seem fit or slim actually developing diabetes because of alcohol.
Right. Alcohol is sugar, right? And most food that you consume will turn sugar into your body. So your beers and your wines and your alcohol are sugar and can affect your sugar level significantly, right? So
now, if we look at what we have seen as more of some of the end-stage complications, the renal failures that take place or the kidney disease that takes place, those are very expensive and some would say even unsustainable treatments that one would require. And very often it comes from unmanaged diabetes. How do you address an intervention so that anybody who's living with diabetes recognizes that if I don't control my sugar, I may end up on dialysis indefinitely?
And this is where a program such as this will come in handy, because we will train individuals at the community level to build. It's part of building their capacity in self-managing the condition. So monitoring blood glucose levels, monitoring their waist circumference, their body mass index. So having knowledge of these numbers, knowing your numbers, will then help them be aware of if they're at risk for this condition.
Another thing we try to do is encourage the person living with the condition to visit with their physicians, doctors frequently, right? And get your tests done. Some persons will say, well, I don't want to know. It's best that you know you could address it, right? You don't just wake up one morning and you have kidney failure, right? The signs have been there and you've been ignoring them, or you haven't been taking the tests any at all, right? So we encourage get your tests done, know your numbers, as Michelle is saying, right? And you could live a fairly decent life.
Mr. Castillo, let's get some personal insight here. You are the president of the Belize Diabetes Association, and you've been living with diabetes for many years. Tell us firsthand, what are the challenges? Why is it so hard to manage this condition?
All right, first you could start with education, not knowing what to do or what to eat and stuff like that. Then after a time, you learn exactly how to eat and what to eat. Then there's compliance, right? You know that if you consume certain things, it will have effects on everybody, but persons, you will still do it. For me, it has been discipline, right? I found myself to be fairly disciplined. I don't eat things that I shouldn't eat. I eat portion size. I watch what I drink. I watch what I eat, right? It has a lot to do with discipline. So first you need to educate yourself and what the do's and the don'ts are, and from there you discipline yourself. It can be fairly easy, but the discipline, the temptation is always there.
It appears to be challenging, however, because if you're someone who lack a sense of self-discipline, then this seems an insurmountable task to try to get things in line.
Yep, exactly. So
and if everywhere you're going, there are large portion sizes, high carb meals. If you buy a takeout meal in Belize, it's more carbs and fats than it is anything else.
And it's always there, so it's left to the individual to make that decision on what to consume. Right.
Have there been any strategies to help people? Discipline is hard. I think if anybody just thinks of losing 5 pounds or going to a gym, maybe even if you want to gain muscle, it requires discipline and it's hard.
Right, and so one of the things that we have to bear in mind as a nation is supporting, the built and the local environments in which we live in. So for example, having our workplaces or businesses support, exercise groups. Right now at the Ministry of Health, we just finished having a boot camp where, different staff and even members from other ministries joined in just to, engage together as a group and focus on increasing our physical activity and again being role models to other individuals around you and to your family members as well. So it starts everywhere we go.
And what have you found in terms of support? How important is it that, for example, your family is eating the same thing that you're eating, rather than them having a nice big plate of rice and beans and I have to eat the salad?
There's no such thing as a diabetic diet or diabetic pot in my home. Everyone eats the same thing, right? It goes a lot back to portion size. We as a people, we like a lot, we like plenty, right? So if you put your portion size in order, you should be fairly okay. We say that for us living with diabetes, instead of eating 3 big meals a day, we try to eat 6 small ones as you go along, because your body can't process a lot of food, so you can't just load up and foods, and then your body is not making adequate amount of insulin to break down that food for you.
Right? So portion size it's even more important.
Yeah, we have a chart.
That's interesting because, as you said, Mr. Castillo, as Belizeans particularly, the more the merrier, as we say on our plate, right? So that when you try to, say, apportion certain amounts of rice, for instance, in a dish, certain amount of greens and what have you, we're not used to that. We want a lot of rice, a lot of gravy, the whole mashed potato, the salad and everything to go along with it, but we're not necessarily looking at how much we're consuming in terms of the nutritional content of each of those portions.
And if persons would eat portion size, not necessarily because you're living with diabetes, it would be healthier for everyone, right? But usually we make that adjustment after we develop the condition. Then we say, well, I need to stop doing certain things or do certain things.
Practice after a race, as we call it.
Exactly, right.
And talk to us about that aspect. How do you, with the persons that you've trained, get people? It's almost a re-education as to how to eat.
Right.
If my daily consumption is rice and beans, chicken and salad with potato salad specifically, how do I get someone to break that habit and change to something else?
Well, a lot of it has to boil down to taking ownership of your own health, and just seeing your family members who might be experiencing the condition. That might be one of the greatest incentive for you. As a community lay person, that would serve as my incentive to just get on a healthier path. So the health educators and the community health workers would go in using what they know about their communities, what they grow in their communities, what is available to them. Nothing that's expensive or hard to obtain. It's just having secure food sources, having the environment around be supportive. So it's just basically using what you already have.
Yeah. Do you find that people who are living with diabetes are fully cognizant of the threats to their quality of life? I mean, if I think of the Diabetes Association especially, you work educating all the time, and every now and again we hear of one member who's been speaking out losing their life to complications of this condition. Where seems to be the challenges?
Several things can be the challenge. Sometimes economic condition, right? Once you develop a condition, you need to be on meds, either oral medication or insulin itself. For some folks, they're able to purchase their meds. Some will receive it at a minimum cost from some of the clinics. But the challenge could be where the funds are limited and you need to buy food, you need to buy medication. So which one will you purchase? All right.
Yeah.
So that hard choice is there from time to time. Along with, as I said earlier, compliance. You know that you shouldn't do certain things, or you shouldn't consume so much of one thing, but you still somewhat yield to the temptation and do it. So it's a combination of times. Economic condition could be, and then compliance is another issue as well.
So I have no concept of what this would cost, but if I am diagnosed with diabetes today, and I have to check my sugar how many times a day?
Initially, maybe 3 or 4 times a day. Initially, once you've just been recently diagnosed, you need to know where you are. You need to know which foods move your sugar level to what range. So you may need to do it more frequently, like 3 or 4 times a day initially. Thereafter, you could probably do it maybe once a day. But it comes with a cost because they have the meter, you have a glucometer, and you have the strips.
I was going to ask, what does that cost? Is it expensive?
It all depends.
Yeah.
In most cases, the meters are almost free, but they catch you the strips. It's something with pharmaceutical companies. That's where they make the monies, from the strips. I'll plug this in for the Diabetes Association. We have economically cost monitors and strips at our office, right? We try to bring down the cost, which makes it affordable for most persons. It could be costly, especially the strips could range $50 upward, right? For vial of 50.
Wow.
Right, up to 100. So depending on which meters you're using, the cost of the strip goes up.
And what about the medication? What would be the average cost if I'm put on meds? Pills, specifically.
I'm sure. Would you have... 2 of the more commonly used meds are metformin and glyburide. Those would be about 25 cents a piece.
Okay.
Yeah, about 25 cents a piece. But everything adds up, and it depends on where you are on the economic ladder, right? So for some people it would be manageable, and others, there are folks who come, I can't buy a syringe, which is 50 cents, right? You go to the drugstore, 50 cents, and I couldn't take my insulin this morning because I couldn't buy a syringe for 50 cents, right? So everything comes with a cost and depends on where you are.
So when you compare the cost, versus eating healthy and exercising, I mean, that's something that won't be as expensive if you invest in just engaging in a 30-minute walk, right? Or cutting down on your portion meals. For us, that's a big reduction. You don't have to, prevention is better than the cost that you will spend.
And prevention is cheaper than the cure.
Right.
Right.
What we've also found alarming is the number of younger persons developing type 2 diabetes.
Yeah.
Type 2 is basically for older persons, right? While type 1 you'll find in children and young adults. But when we have a younger person developing type 2 diabetes, that's a concern because it's a lifestyle condition. So our young persons are not necessarily eating healthy, they're not necessarily exercising. So for persons who are not living with a condition, we advocate that you try to eat healthy, a balanced diet, and exercise. Those are the two things. For us living with a condition, then you need to eat healthy, exercise, and take your medication. And as you're on medication, for us as people living in tropical countries, there are many other substances that you could use, herbs and barks and so on. My advice is that you work closely with a doctor, your physician. Some of these herbs and barks may have properties in them that can lower your sugar level and send into crisis as well. So once you're placed on meds, you adhere to whatever meds you're placed on. If you'll try something else, consult with your doctors and physician, right, before you put yourself into complications.
Now, how will this program work? You spoke of having health educators in communities. What communities are you going into?
Well, this will be rolled out in all 6 districts. In every district we have our community health workers. So we have about 200 of these community health workers who are all volunteers. So we'll start with the training of the district health educators and the CHWs on community-based diabetes education. Thereafter, we also plan to simply increase the knowledge and awareness of diabetes at the community level. And this includes, the referral process to the primary care services as well for these diabetic patients. So once we have that training completed, then we will have our patients selected at each of these communities, and every CHW will be assigned with a group of patients to work closely with in delivering education on certain topics around nutrition, physical activity, weight, foot care management, eye care. So those are all different areas that they will be receiving training on.
So let's take the opportunity to educate people right now. There are 2 types of diabetes. Let's start there. Right?
Type 1 diabetes, found in children and young adults. At this time, there's no known reason why a person is born with type 1 diabetes. So once you're born with diabetes, which is type 1, you are placed on insulin. That's the only treatment at this time. You're placed on insulin injection. You could use either the syringe or the insulin pump. Type 2 diabetes found in mostly older persons.
And now in children too.
Right, and now in children as well. Usually it's treated initially with oral medication. You'll be placed on some kind of oral medication, some pills, and they ask you to exercise, right, and look at your food intake. What is the one?
Yeah, with type 2 diabetes, it's insulin. It's not dependent on insulin. So it's your body is not responding. The cells in your body are not responding well to the insulin. As you know, insulin is a hormone that's produced by the pancreas, and it functions as a key that allows the cells to take up glucose for energy. And so with type 2, there's a malfunction. The body cells are not responding to that insulin the way it should respond.
So what are the... Go ahead.
I also want to add that in type 2, while oral medication is mostly used, there are also some type 2 who need to use insulin, like myself. I've been living with diabetes for a little over 25 years, right? I began with oral medication. A few years ago, the oral medication was not controlling my sugar level, so hence I was put on insulin, and I've been doing well since then. Fairly well, given the condition. So, not necessarily oral, but some also do the insulin.
So, what are the risk factors? Type 2 is the type that you develop. What are the risk factors? What makes one person more prone to developing diabetes than another?
So some of the risk factors, apart from having, a family member who is diabetic, and you might have had gestational diabetes, that's also a risk factor. The two leading risk factors that we try to address, being overweight and being obese. So others may include tobacco consumption as well as the harmful use of alcohol, as you mentioned earlier. So those are your risk factors. In fact, in Belize, we have overweight and obesity having, a prevalence of 50% and 20% respectively.
Yeah.
Wow.
So those are the two risk factors that we have to focus on.
2 out of 3 Belizeans
Right.
are overweight or obese.
And women are more
More-
predisposed as a result.
The prevalence of diabetes in females is higher than males, but we must also take into consideration that
Go
males might not
to the clinic.
access
Clinic.
healthcare services as frequently as women do.
There is a specific link between what you call your waist circumference, which means your belly fat, and diabetes. Can you tell us more about that so people know?
Well, apart from using your body mass index, we also tend to use the amount of fat that accumulates around your waist. That might be a better indication or a better measurement to see what your risk is for developing diabetes. So, reducing that fat around that midsection might also reduce your risk.
Your
so
risk.
that's something that we try to monitor.
So we spoke of risk factors. Let's talk about signs and symptoms.
Like I said earlier, some of the signs and symptoms may take a while to manifest themselves,
Yeah.
or it takes over a period of years. So you have frequent urination, you have increased appetite, you have rapid weight loss. That are the normal, symptoms, the common symptoms. But when you talk about more severe complications, you have impaired blood circulation, which can then lead to the amputation. You have renal failure, we have vision loss.
Yeah.
So those are the more severe complication. That's when, you reach that point that you do need treatment.
So let's talk to the people who have been diagnosed with diabetes, any part of the country who have access to this. What do we need to tell them about what they should do to preserve the quality of life that they want?
For us at the Belize Diabetes Association, we try to establish our branches in all the districts. So wherever you are, you'll be able to join one of our branches, right, and get your monthly information and education on the condition. When a person develops a condition, the entire family is affected as well.
Yeah.
So when this person will be invited to come to the meeting, bring along a family member, let all of us know and learn how to cope with this condition. So as I said, we're a support group for persons living with a condition, and in most of our districts, we have in Punta Gorda, Belmopan, Cayo, Corozal at this time. Orange Walk is the only district where we need to strengthen our branch, right? But we try to do our work to inform and educate the public, come to the meetings and learn about this condition.
And so we have to eat healthy.
Right. So we encourage prevention and looking at education, early diagnosis, and that means getting your glucose level tested and monitored in combination with, eating healthy, exercising regularly, cutting down on your alcohol intake, not smoking. So we try to look at a more comprehensive approach than just to target one specific area.
All right, and we have a sample image of a plate of rice and beans. And, I'm going to prepare
Portioned
yours
off.
for this. This is the proper portion that you are supposed to eat. Let's see if we can get a shot of this here. Right? So here we have, and talk us through this. Why is this the best portion? And it doesn't look like the typical rice and beans that people buy.
It's a balanced diet,
Yeah.
right? It is balanced, right? But for us, typically in Belize, you'll have more rice,
Yeah.
In this image, it shows where we have more vegetable than rice.
Or you would
Right.
have your rice and beans along with some mashed potatoes.
Potatoes, right.
So that's just too much carbs already
carbs,
there.
two starches.
Right.
Half the plate should be vegetables.
Vegetables.
So we
exactly.
have broccoli there, which means it could be cooked or like steamed or
Steamed,
fresh.
right.
And,
Your
you have a
grilled
garden.
chicken.
Yeah.
And I like to emphasize this is not a diabetic diet. This is for everyone.
This is a healthy diet.
A healthy diet. That's it.
And you're also showcasing chicken breast and not necessarily other portions. Why is that?
Don't get the questions.
It's
Yeah.
it's grilled chicken,
Yeah.
so you don't find as much of the. It's not fried, so not too much trans fat,
Fats,
not too
fats.
much saturated oil. So it's just having that protein that your body requires, and for repair of tissues. And of course, like Mr. Castillo said, we want to fill that plate more with vegetables and greens
And water.
And
water.
Lots of
Yeah.
And avoiding
That's
too much sugary
And sodas,
drinks,
right.
Yeah.
sodas. There we see a piece of fruit, so that's a healthy option as well. And we want to encourage that, especially among the young children. We know that school has started, and you know they will want to access all these sugary snacks. So we want to encourage parents to send their children with fruits and vegetables and
Yeah.
just healthy options.
Of course. All right. And if someone is living in a rural area and wants to get, maybe they are living with diabetes and they want to learn more from your health educator, how do they know if there's someone in their area?
Well, most of the communities have a community health worker, and that community health worker is normally selected by the community itself. So the community already knows, okay, our community has Miss Maria, who's our CHW, and if we need to go for our glucose monitoring, she's available. If we want her blood pressure to get checked, that CHW is also available. So this is especially important in areas where you might not have access directly to a health facility.
Yeah.
And that's where that person plays a key role.
Yeah. Is there a target for this project? Because you're talking prevention, so we're talking of having less people being diagnosed with diabetes, I'd imagine. What's the target?
Well, the overall goal for us is to just improve the quality of life for people living with diabetes, and also to minimize the risk of those who might, already start displaying the signs and symptoms. So it's basically to increase the awareness of diabetes, and the project as well will underscores the importance of continued education around this particular NCD.
All right.
Okay.
And anything else you'd like to share, Mr. Cass, how people can get in touch with the Diabetes Association?
All right. Here in Belize City, we still meet every third Saturday of the month at IT Vet, and the meeting is open to everyone to come. You're living with diabetes or otherwise, you could feel free to join us. Usually in November is Diabetes Month, but we are trying to step up our campaign, reach out more to schools and workplaces and share the word on diabetes. As I said, the increase in diabetes is global, including Belize, and we think we need to step up to inform and educate our Belizean people on this condition, right? As I said, if you're living with the condition, then there are certain things you need to do, and if you haven't acquired, then you could remain diabetes-free and stem the rise or developing the condition as well.
All right. Well, thank you for coming in and having this conversation. And best of luck.
Thank you
Thank
too
you.
for having us.
We're going to go ahead and take a break. When we come back, we're going to be talking about dealing with emergencies during the September celebration. So stay tuned.